Hi, my name is Monica Kemper, and I'm a physical therapist and program director here at Ecumen Detroit Lakes. And today I'd like to talk to you a little bit about what physical therapy is, why you may need physical therapy, and then what to look for in a physical therapist. So first off, what is physical therapy? So physical therapy is the treatment of an illness, injury, or any type of pathology that we'll use to treat with exercise, physical agents, and then our manual skills. And so the physical agents may include electrical stimulation or ultrasound. Manual therapy would include a soft tissue massage or a deep tissue massage depending on the needs. And then we'll guide you specifically through a number of different exercises to target the muscles that are specifically involved in your pathology. So when you're looking for a physical therapist or when you go for physical therapy, your treatment can be completed by a physical therapist or a physical therapy assistant. So typically when you start therapy, the treatment's first and your evaluation is first completed by a physical therapist. And then the treatment can be carried out by a physical therapy assistant. So the physical therapist completes the documentation, ensures that the documentation includes what your goals are, and then the physical therapy assistant can carry out that treatment if the therapist is not available due to scheduling or whatever it may be. But both are completely capable of carrying out the treatment and to meet your goals. So as the years have progressed, therapy has also progressed. So years ago, oftentimes people were hospitalized for weeks or months on end where the primary treatment would be bed rest. But now research indicates that the best treatment is typically to get up and mobilize with exercise or with walking as soon as possible. So this may include day one of surgery or day one of admission. And so different settings that you can receive therapy would be the hospital. So that would be the primary or the first setting that you typically start in if you had an acute injury or any type of surgery. Subacute settings would include a rehab hospital, which is typically at least 3 hours of therapy, that's per day, and then transitional care or the TCU, where this is considered a subacute setting, can vary with the amount of therapy that you receive from 30 minutes a day to 80 to 90 minutes a day, depending on the patient's needs. And so typically the transitional care setting is what we have here at Ecumen, is for those individuals who come from the hospital who aren't quite ready to go home but don't need the high intensity of the hospital. And so it's just that short in between. We get you where you need to be in order to go home, and then you can go home with home health therapy or outpatient therapy. And then outpatient therapy is also something that we offer here at Ecumen. And so now that you know the settings, why would you need physical therapy? So one of the big things is pain. And so oftentimes as we age, we think that pain is a normal part of aging, which it's not. So pain is an indication that something is going wrong within our body. And so physical therapists, we can treat that rather than using surgery or medications. We can start some treatment with exercise, stretching, or those physical agents like I talked about in the beginning. And so that can be completed on an inpatient or an outpatient setting, typically within the home health or the outpatient coming into the clinic. But there's lots of different treatments. One other treatment that we can use would be the aquatic therapy or the pool. And so we do have a pool here at Ecumen that's a therapeutic temperature, so 93 to 94 degrees versus the normal community center pool, which is a little bit cooler. And with the buoyancy of the water and then the warmth of the water, it's able to help you relax so you can experience less pain. There's less stress on the joints due to the buoyancy of the water. And we can start to work on the strength, range of motion, and things of that nature to get you back to where you need to be. There's also the option of underwater treadmills, so we can work on your endurance and your walking to correct some of those deviations that you might have that may create that pain. And so there's a multitude of different treatments that are available to you specifically just for pain. So a couple other reasons that you might need therapy may be because of recurrent falls or because of weakness. So falls can be because of you're experiencing weakness, but it could also be because you're experiencing vertigo, which can be within the inner ear. It's just the stones within the ear may become dislodged and can cause the dizziness. And so this is typically when you roll over in bed, change positions, that all of a sudden the room starts spinning. And this is not related to your blood pressure, it's the room is actually spinning and you're not feeling lightheaded but dizzy. So physical therapy, we're able to treat that specific area of your diagnosis with the loss of balance. and we're able to hopefully get those stones lodged back in places to where they need to be so you don't experience that dizziness. Along with the weakness, there's a multitude of different treatments that we can use in order to improve your strength. Like I said, we can use the pool, but we can also do a multitude of different exercises, specifically what you would need to reduce your risk of falls and to get you back to what you need to be. So the primary thing that we're looking for is to improve your quality of life. And so if you cannot do the exercises or the activities of daily living that you need to do, or walking around the house, or going to play cards, or going to your grandchildren's events, whatever it may be, we want to help you to be able to do those things. And so when it comes time to when you notice that, okay, I'm starting to experience more pain, I'm having falls, there's the obvious reasons of surgery, strokes, Parkinson's, things of that nature, but when you just start to notice that slight decline, we're here to help. And so when it comes to what do you need in a physical therapist and what should you look for, the primary thing is to look for someone who you can trust and who you feel confident and who is knowledgeable in their treatments. And so you want to be comfortable with this person because they're probably going to be working with you for at least a couple weeks, if not more, depending on how fast and things progress. And you want to be able to establish that good rapport, because usually it's not just the physical side of things, but there's some emotional and social type of impairment that's also involved in your physical health. And so establishing that rapport and getting to know your therapist is something that you'll want to look for. Things to look for in your parent may be that they're starting to withdraw from the community, so they're not going to do their grocery shopping, or they're doing short trips just to gather the necessary items, or they're not going out to coffee or to the restaurants or things of that nature where they normally were very active within the community. You may also notice that they've had a couple falls, or they're not doing their laundry or keeping their house as clean as what they once did prior to the years. There's also that they just might become more immobile just sitting in the chair, and so when they come to visit or you go to visit, once they start to walk around the house, they might just become short of breath, and that's just because of progressive weakness with immobility, and those are all things that a physical therapist is able to treat. We encourage you as a child, encourage your parent to receive or to seek out physical therapy in order to maximize their quality of life, to allow them to live a more meaningful life, and then to be able to do the things that they'd like to do. And that's something that's important to you, that's important to them, and we need to be able to ensure that they're able to do that to live the best life that they can.